everyone, my name's Hannah. I'm a level 1 nursing student at USF, and I'm going to be going through tracheostomy care today. I have my kit, my gloves, and my mannequin. Is this a sterile procedure? So we're just going to get right on into it.
To begin this procedure, you're going to perform AID-IT, which means acknowledge, introduce, duration, explanation, and thank you. It's essentially just a way to remember everything you have to hit, what you have to tell the patient, and then the order you have to do it. You are also going to verify the physician's orders in the care plan, as well as perform hand hygiene and don gloves for the non-sterile portion of the procedure, which you're about to see me do.
Okay, so the first step of this procedure is actually just introducing yourself. We call it AID-IT, and then you also have to verify 2 verifications of the patient. We usually use name and date of birth. So when I walk into the room, I will knock, and then I'll perform hand hygiene, and I'll go up to the patient and introduce myself. Hi, my name is Hannah. I'm going to be your nurse for today, and we are going to be doing a tracheostomy cleaning and care. It should only take about 10 to 15 minutes of your time, if that's okay with you. Before I start anything, can I verify your name and your date of birth? The patient would repeat it back to me, and we would get started from there. And I would ask about allergies and confirm the order that the provider has given. So to start off the procedure, I've donned the non-sterile gloves and I've already assessed the patient's vital signs. I'm going to take a look at the tracheostomy dressing that's already on the patient and just assess for skin breakdown, which is important because with the tracheostomy collar, some friction can cause skin irritation and breakdown. So I will just gently pull this out, it's stuck under the mannequin. And this is when you would look around the tracheostomy collar, look for any abnormalities or liquid, secretions, anything like that. Looking good for now.
The rest of the procedure is going to be a sterile procedure, which requires sterile technique. You have to change the clean gloves you have on for the sterile gloves as you build your sterile field, and you open your tracheostomy kit and your suctioning kit. Suctioning is a part of tracheostomy care, and it is a modified sterile procedure. The lube that goes on the tip of the suction catheter must remain sterile as it is being inserted into the patient's airway. You want to make sure you dispose of any soiled equipment properly, and you do not break your sterile field by moving different non-sterile objects over it. Once something non-sterile touches a sterile object, it just completely gets rid of the sterility of the object. A good tip to prevent breaking your sterile field is to not turn your back to it and to prep everything before and put your items in their proper place before starting to ensure that sterility is kept.
So now we're going to begin the actual procedure. Tracheostomy cleaning is a sterile procedure, so I've taken off my old gloves. I'm going to put sterile ones on, and then I'm going to go through my kit. Tracheostomy cleaning, like I said, because it's a sterile procedure, we don't want any bad bacteria to get into the patient's respiratory system and cause an infection. So we're going to start by opening up my kit. I'm going to open it away from myself. All right, it is used. And now that that kit is open, everything in there is sterile, so I have to put on sterile gloves. So I will do that right now. Opening it away from myself. You can only touch the 1-inch border around it. Take my right ones. I'm probably gonna cut a lot out of this. Right, and you scoop under. And you can fix it because this is sterile and this is sterile. This is not sterile though, so I have to leave it like that, which is gonna bother me, but that's okay. Okay, and you move this, and now you have a sterile field. So now you take the paper that they give you, touching the 1-inch border. You're gonna place it down, not crossing it, and then you're just gonna prep your sterile field. This is the pipe cleaners you're gonna use to clean the inside of the tracheostomy collar. Cannula, it's called. Okay, this is the ribbon. in, or we can take it out. Just put it over here. And then all your cotton swabs, you're also going to use to clean the site and the trachea cannula. And then I would typically have some solution in here that you pour into the container, and that's what you would use to clean the cannula.
Once you prepare your sterile field and you open up all your kits and get all of your equipment out, you want to suction the patient's airway. Suctioning a patient with a tracheostomy helps us clear the airway of any secretions or thick mucus buildup, and it helps the patient breathe better too. You want to do this before you start actually cleaning the inner cannula. You want to maintain a clean hand, typically your non-dominant hand. This will hold the base of the suction, and your sterile hand, which would be your dominant hand, would handle the suction tubing. It is important to hyperoxygenate your patient before and in between passes of suctioning because you're removing a high level of oxygen from the lungs, and by hyperoxygenating them, you will be replenishing that lost oxygen.
So now I'm going to go over to my patient and take off this cannula. Once I touch this, it's no longer sterile, so I can't touch any of my sterile field with it. Just twist it out, put it into the solution, kind of leave it sticking out a bit. Maybe if I can get this down. Okay, perfect.
This is just a quick picture of what the inner cannula should look like when you place it into the box or plastic casing you have. Typically there would be some solution in there. It wasn't on hand, but that's the position. You want the tubing to be in the water, but you kind of want the ending plastic part to be sticking out so you can easily grab it.
And then you start cleaning it. I'm going to start by using one of the cotton swabs, and I'll do the outside of it. These are already, they should have solution on them. These are dry, but just for purposes, I'm going to clean the outside. Then don't get it in your sterile field. And then away from your sterile field. And then the pipe cleaners you fold and stick inside. Like this. I'll do one more just for good measure. I'm not gonna fold this one. Just like this. Okay, now I'm going to let the cannula dry through air, and then I'm going to insert it back into the tracheostomy collar. So we're just going to do this in another twisting motion, like so, and then lock it in place, and it's back in.
So I went over skincare and breakdown a little bit before earlier in this video, but I wanted to reiterate how important skincare is for tracheostomy care. Because of the open airway, there is an increased risk of infection and skin breakdown, which is something we want to avoid because that would just break skin integrity. In order to maintain skin integrity around the site, you want to make sure you thoroughly clean the outer cannula, faceplate, and the surrounding area. You want to dry all the moist areas that you have wiped down in order to avoid bacteria buildup. And you also want to keep monitoring that tracheostomy collar or the strap that goes around the neck for any skin irritation, because sometimes rubbing can create that kind of friction that can lead to further skin breakdown. All of these techniques will keep skin integrity and just ensure the decreased risk of infection.
So now that the inner cannula is back in the tracheostomy, we're just going to clean around the area. It's no longer a sterile procedure, so I'm just going to keep the same gloves on though to save supplies. So you're going to take one of the Q-tips from the kit, and you're going to clean the faceplate, inner cannula, or outer cannula, and then the surrounding area of secretions, okay? So you're just going to go around this is the faceplate, and you want to make sure to get under the faceplate. Be gentle. All right, just like that. So now one of the last steps of the procedure is to change the tracheostomy collar, which is the ribbon or strap that holds it in place. I'm going to take this ribbon from the kit and I'm going to insert it into the side of the faceplate, just like this, and then undo the other one. And then I'm going to lift the patient's head. You would typically have 2 people doing this, but that's okay. And then insert the second part of the ribbon into the other side of the faceplate, like so. And I'm not necessarily gonna tie it, but you get the gist. And then you just take off the other, it's kind of like the gloves. Ooh, it's really like the gloves. Okay. Then you lift the head back, and then you're done.
Yay!
Now that you're done tracheostomy cleaning, you would obviously lower the bed into the lowest position, place the call light on the right-hand side, and let the patient know that they need anything, you're outside. And you would also assess vital signs before you go, just to make sure that everything is good with the tracheostomy collar. Thanks for watching.